Hello, everybody. This is Dr. Adam Rinde, and welcome to the One Thing podcast. This is episode 105. In this episode of the One Thing podcast, Dr. Sandra Paulsen, a well-regarded psychologist and author, discusses her professional journey and expertise in psychotherapy, particularly focusing on her work with autism and EMDR, which is otherwise known as eye movement desensitization and reprocessing. Dr. Paulsen shares her own experiences with autism, describing her initial skepticism about her diagnosis and how she came to embrace it. She highlights her approach to treating trauma and emotional issues in autistic spectrum disordered patients, emphasizing the need for gentle, tailored interventions due to their sensitive nervous systems. Dr. Paulsen also explains the challenges and benefits of autism, the importance of recognizing emotional and physical sensations in therapy, and how her work is often inspired by visual aids and cartoons. Throughout the conversation, Dr. Paulsen explores the nuances of autism, including social dynamics, systematic thinking, and the controversial discussions around autism in the mental health field. She talks a lot about her newest book, The Beauty and Burden of Autism, which utilizes her original cartoons to illustrate and explain various psychological constructs related to autism. This book is for both practitioners and people who are dealing and living with the autism spectrum disorder. And now, a formal introduction to our guest. Sandra Paulsen is an international instructor, author, and illustrator of principles and procedures for EMDR with complex trauma, including structural and somatic disassociation and trauma held in implicit memory. Her books include co-editing The Neurobiology and Treatment of Traumatic Disassociation Toward an Embodied Self. She wrote and illustrated Looking Through the Eyes of Trauma, an illustrated guide for EMDR therapists and clients, and When There Are No Words, EMDR for Very Early Trauma and Implicit Memory, and co-authored We're Listening Body, Integrating EMDR, Somatic and Ego State Therapies. In her latest book, The Beauty and Burden of Autism, an illustrated guide and workbook, and another recent book called Indigenous Trauma and Disassociation Healers, Psychotherapies and the Drum with Shelley Spear Chief. I met Sandra during a very pivotal time of my life when I experienced some very traumatic experiences with my first son who was going through surgery related to pediatric cancer treatment. Sandra really helped me in those moments of dealing with some very unfortunate things that I witnessed. I'm so grateful and have waited a long time for the opportunity to bring her on as a guest. And I'm very excited for you to hear her wisdom and experience a taste of what it's like to sit with her in her presence. So without further ado, welcome to the next episode of the One Thing podcast. Dr. Paulsen, welcome to the One Thing podcast. It's a delight to be here with you today.
Thank you so much for having me. I'm delighted to be here and delighted to see you again.
Thank you. Yes, it was great reconnecting. For the people listening to this, I'm going to just mention I am someone who actually went to you for help at a very crucial time of my life, and I'm forever grateful for how much you helped me, and I've become a huge fan of your work ever since. And maybe we'll get into a little bit of that later, but thank you for being here, and I've told so many people about you over the years. For those people new to your work, it would just be great to hear a little bit about your career trajectory, like how you got into the work you do and how that's led you to also work with focusing on autism.
Okay. I was originally trained as a cognitive behaviorist at the University of Hawaii, Manoa. And I was out for a couple years doing that. and heard about this new method called EMDR, which I learned from an article, I thought, because at the beginning, Francine Shapiro didn't teach it formally. She just published an article about it. Long story short, considerable training is needed to use it well and ethically and competently, and it also needs to be combined with other things. I've been doing nothing but trauma work since about 1990, and EMDR since 92 or 91, and then tripped over dissociative disorders, actually. Got trained in that in the early 90s as well. So I've always used EMDR and ego state work together, and then added in somatic work. And then another paradigm shift when I started using modifications that were initiated by Katie O'Shea, and she collaborated with me because I was known for my work with complex cases. And what she did was modify EMDR for when we're working with implicit memory, as opposed to the picture memory one might have of the fiery car crash and the narrative of what happened that day. When in the first 3 years of life, say, there is no picture memory and there may be no narrative except what one has been told. And yet there are ways that we can use EMDR in a modified fashion to do that work systematically, even in the dark. And so I've been doing that. I've got a book on that and workshops on that for 15 years. And I work in the intensive format, 3 days at a time. So I do an intake with people, and then they're here for 6 hours a day of work for 3 days in a row, and then they fly home to whatever state or country they came from. And I've been doing that for a long time as well. I hate to think how many years. So it's a rarefied practice, but a lot of people like that intensive format because it allows us to get a lot done. Plus, my intuition works well in that setting. I can keep the thread of the various themes that are nuanced. I call them dust bunnies. Much better than in the 1 hour or 45-minute format where there's lots of transitions and gear changing. I can't remember quite how I got interested in autism, except it started when I was 9, when I said to my mom, could I be autistic? And she laughed uproariously because she was a librarian back in the day when you didn't have to have a degree to be a librarian.
Yeah.
And this is in a little town in North Dakota. And she sometimes was a substitute teacher for the special ed class. If the special ed teacher was out sick, my mom would be sent over there. And so her idea of what autism looked like was quite different from me. But long story short, and I believe the same thing, even as a mental health professional. For many years, I thought autism was something else besides me because I was doing very well, very successful. I teach a lot. I travel all over the world. Of course, there were all these things about having my nervous system overwhelmed by too much stimulation. And I didn't realize for a while that many of the things that I struggle with were from autism. And so probably 10, 12 years ago, I started looking at it again in earnest. Although it came to my mind many times over the years, I'd always dismiss it. But the field has been changing as well. And I think that the field and I met each other halfway. And as I learned more and more, I found that, as usual, my work is inspired by cartoons. With all my books, all but the scholarly one, I illustrate psychological constructs with original cartoons. Autistics' tendency to be visual thinkers. And so I started amassing autism cartoons, and then I started teaching from them. And then just recently, a couple of weeks ago, published, and it's got stickies all over it, but The Beauty and Burden of Autism, an illustrated guide and workbook. And it's full of my original cartoons. This is the color version, And then because it's that's the trouble with wielding books around. They knock things over. This is black and white, much, much cheaper to print. Not nearly as
Mm-hmm.
fun as the color one, which I developed thinking that it would be used in therapists' offices because therapists
Right.
will spring for it or doctors might spring for it. But it's very approachable because of the cartoons.
Mm-hmm. And so, did your interest 10 to 12 years ago come about because you started seeing more people inquiring or questioning or expressing they might be dealing with autism, or did it just develop organically in other ways?
I think it was all that and more that I had a few people come in. I get a lot of referrals of Microsoft engineers, many of whom are autistic, but so are a lot of physicians and
Mm-hmm.
even mental health professionals. But at the same time, things were happening in books and on YouTube where I'd start seeing more, and if I'd follow a link, I'd go, huh, what do you know? So they'd be talking about, I think the angle I took was about what autism looks like in girls. Because if
Mm.
you think the stereotype idea of what autism looked like is based on boys or men. And autistic females don't have pocket protectors with or do calculations as much. The things that we systematize might be different than what men systematize. Many autistic, and if I speak in generalizations, it's because we have little time and I've got a cartoonist mind, so I oversimplify everything. That's my strength and weakness. But as I'll say as a disclaimer, nothing I say applies to every autistic. And there's a famous quote, I forget his name right now, naturally. If you've met one Aspie, you've met one Aspie. And we don't use that word anymore because the DSM changed again. But the idea being that there's so many individual differences. Many autistics are systematic thinkers. That is, we naturally future pace, like we think of if this behavior is routinized and done again tomorrow and the next day, where will I be in 15 years? And some people apply that to mathematics or physics or
Mm-hmm.
medicine, like
Mm-hmm.
cardiology. And some people apply it to feelings. I apply it to feelings. When I was also 9, I was growing pumpkins and I had lots and lots of pumpkins. I had dozens of pumpkins. And I carved each one to express a different facial expression of an emotion.
Mm-hmm.
And then in junior high, created art and sculptures for each emotion. Autistics aren't supposed to be mindful of emotions, but I'm on what I like to call the lunatic fringe of perceiving emotions because I've systematized it.
Mm-hmm.
It's one of my special interests. Got a PhD in psychology, and here I am.
Mm-hmm. Yeah, it's up a little bit. It's really interesting going to see you um, as a patient. You helped me with a big T, as they say, big trauma, where I experienced something very serious and severe, and with one of my children, and his a life threatening experience with him. And what was really fascinating, and maybe you can talk a little bit about this, is how you have this way of being gentle with your clients when necessary, and you have like different gears of, let's say, intensity. And I think you even developed a special approach where just going right for the trauma or going is sometimes trauma. So can you talk a little bit about that? Because I think that's really what stood out when I was working with you, is how I was able to work on what I experienced but not be traumatized.
That's really interesting you should say that because I don't think of myself as being especially careful. I I often describe myself as being quite surgical.
Hmm.
And But I know that I can't do the surgery if people are jumping off the table, running down the hall. I have to bring people along. So I certainly do a
Mm.
lot of bringing people along, and perhaps that's what you're referring to. It's been so
Yeah.
long, I can't remember specific techniques that I might have used, and it's all intuitive anyway.
Yeah, that makes sense. Yeah, I just always use that example because I think the the work is so vulnerable, and to be able to be the right amount of dosing or intensity or
Mhm, mhm,
precision if you're thinking from a surgical standpoint with
mhm.
the right amount of force. And so that was really something that really stood out to me.
And it
Um,
was EMDR, wasn't it?
it was
Mostly,
EMDR, yes.
yeah. So EMDR, if you've been doing something for 35 years, you get pretty good at it. And
Yeah,
there's lots of nuances to it. And
yeah.
Francine Shapiro, the originator of it, really guided us well. And if one sticks to that, only modifying the protocols where it's absolutely necessary, then one can do a reliably good job. It's
Hmm.
hard to see a lot of the EMDR has gone just, there's so many EMDR practitioners now, which is wonderful if they're properly trained and credentialed.
Hmm. Yeah, and for me, it was really special because you're out on Bainbridge, one of the islands here in the Puget Sound, and taking the boat out there to see you and your property, and had such a special energy, and your therapy dog just made you feel just like you were in a safe place for this experience. And then I remember coming back from the day I spent with you and taking the boat back in the sunset and feeling like I could show up again and be there for my son, which was the primary reason I
Mhm.
wanted to go see you. So it was really profound. Thank you again.
I'm so
Yeah.
glad.
Yeah. So going into autism a little bit more, I work with a lot of patients who identify or have been diagnosed as being on the spectrum. And there's there seems to be some controversy about how we talk about this subject, how we look at it, and how we work with it. Can you talk about why there's controversies and what some of them are?
Yes, it's a field fraught with discord and conflict. And I think it's because it's changing bottom up. I'm looking for a particular cartoon, which of course I'm not going to be able to find. But I've got a cartoon where there's two professionals jousting with each other.
I remember
Um,
that one. Yeah.
it's okay. So historically, the term autism, the diagnosis was, it was considered a bad thing, a disease. It's in the Diagnostic Statistical Manual of Diseases. And there's been some back and forth, as there always is, about the categories. But what's happened, it's almost like a groundswell bottom up as autistic individuals have demanded to be included in the process, in the research, and to not have it be so pathologized. And I think it boils down to this, that if you're autistic, you're quite the minority. And so, in a room full of neurotypicals, although I'm yet to see my first normal person, I don't know what that means exactly.
Yeah.
If you're an
I know what you
autistic
mean.
person in a room full of non autistic people, let's word it like that, you're going to be the weird one. But if you
Hmm.
get a bunch of autistics together, we have a fine time communicating. We don't necessarily make eye contact with each other. And then if you had like a room full of autistics and one non autistic, guess who's the weirdo's going to be? So that's called the double empathy problem. And so when people say that autistics lack empathy, it's, according to the double empathy theory, it's because they're the minority, and that the so called neurotypicals need to take the time to realize that we're only weird from your point of view. From our point of view, neurotypicals are the weirdos. And it's true. If you ever wanted to hear a list of things that autistic people find annoying about neurotypicals, we could go there. Alienate your entire audience except for the autistic, who would be laughing their heads off.
Yeah. Yeah, it's been interesting for me because my first experience with autism was in going the Defeat Autism Now conferences, which were basically parents who were supporting clinicians to come and look at all these different biomedical solutions. This was way back in
cure?
Yeah, almost like that. And then but also symptom reversal kind of approaches, and that was like a big part of my early training. And then I found that in the last 10 years is really, there's a lot of controversies and concerns about that.
Yes.
And then recently, the last 3 or 4 years, being approached with nutrigenomic solutions and doing genetic testing and looking at various pathways, and then ran into like some people really interested, some people very offended by it. So I think we really have to have a sense of reverence about what are we doing here.
Oh yeah, if you want to offend an autistic person, talk about genetic changes to eliminate autism. The trend more and more is to see the beauty of autism, which is why the name of my book is The Beauty and Burden of Autism. Whoops. Dog jumped up. So it's not, some people, Tony Atwood, who's one of the world's foremost autism clinicians, says he thinks that autism is a leading edge of the evolution of the species. I see autism, my autism at least, and many of the people that I work with, and I don't just work with autistics, mind you, that's just because I keep finding it in people. I see autism as a nickel with two sides. And the same nervous system that's awfully sensitive and easily overwhelmed is the nervous system that comes up with cartoons and synthesizes disparate fields of psychology. And so I get emails all the time from all over the world of people expressing gratitude. And I don't think that if I had a conventional brain, I'd be able to do that. I don't want to sound like I'm crowing too much, but I'm trying to describe that with the challenges, some blessings and some benefits. So that's why I called it The Beauty and Burden of Autism, because it's both. And like a nickel, you can't, if you try to get rid of one side of the nickel, you're going to destroy the nickel. And so let's not think, my cranky elderly dog just bit at me. Let's not think that autism is something to get rid of. Now, I understand that to a parent of a child that has self-injurious behavior is desperate to find solutions. I don't mean to minimize the suffering of those parents or the children, because, in fact, I just got out of a 2-day training so that I can theoretically learn how to assess and diagnose autism using the gold standard of assessment, which is the ADOS-2. That was a heavy sigh because it's not that much fun to do, but compared to curing trauma. But in the course of that, I saw, she's snapping at me. In the course of watching the video, I saw what looked like a lot of suffering in a child, and I could hear his suffering. And it sounded to me like his nervous system was really overwhelmed. And he was in a room full of neuro parents and a clinician, and I really felt for the child. So I don't mean to minimize that there are some individuals and families for whom the problems are significant. But what I am saying is, please, neurotypicals, take a second look and see what accommodations maybe you can make in your friendships or in your families to understand through those eyes of the autistic
Yeah.
person whose nervous system might just be, we talk about the window of tolerance. Are you familiar with that term, the window of tolerance? The
Yes.
idea is for every person, every person can be overwhelmed if you have more challenge than you can manage. And some
Right.
people have tremendous capacity to tolerate stressors and trauma. And some people have a much narrower band. And the autistic nervous system, I believe, has a much narrower window of tolerance. And it's not so easy to just strengthen and expand it, although things can be done. That's why I'm living and working in the forest. That's why
Mm-hmm.
I had this office that you enjoyed the setting. I had this built so that I could work in an environment that for me is peaceful. It's peaceful for the
Mm-hmm.
clients, but it's peaceful for me as
Yeah.
well. So we often do need certain accommodations. And to the neurotypical uninformed eye, that might look, I don't know, selfish. I get people referred to me who had therapists make referrals of clients that they thought were the most narcissistic person they'd ever met. Not narcissistic, autistic. Talking about themselves a lot because they're trying to figure themselves out. Needed a proper diagnosis.
Yeah. So I would like to also go into a little bit more about kind of a little bit more now turning towards like the gifts. So we hear a lot about the challenges and the flip side, the gifts of autism. Like,
Sure, there are a few savants, but much more common are to have more than our fair share of this or that intellectual or artistic capacity. It's well known many autistics are attentive to detail. I don't know. I don't really identify very much with that. I'm a big picture thinker myself. But no doubt, if you combine the unfortunate term is the technical term for when an autistic person has a deep interest in something. And I've got cartoons for every one of these concepts in the book, or nearly everyone. But so somebody, like the stereotype is the 12-year-old boy who knows everything about trains. But if you take that tendency to do deep dives in their passionate interests, then one can become a brilliant cardiologist or a brilliant lawyer with on-demand access to tons of knowledge, or a psychologist that integrates different fields of study, and so on. So if that tendency to do deep dives is applied well, one can become very capable in a profession, which is why places like software companies have neurodiversity executives to make accommodations because they're looking for that level of detail or that level of focused attention and discipline. Autistic folks tend to do well with structure. So if we tend to show up on time and work systematically unless there's some other diagnosis, medical or something that challenges one's capacity to show up on time. But we tend to be reliable because we like our structure. And again, that's a generalization, so it's got to be wrong. My favorite thing about when I meet an autistic person is I can feel the open heart. There's a tendency in autistic people to be open-hearted, to care very much about being authentic. If anything, we go overboard with our truth-telling. In fact, that can be a problem because there's some people you shouldn't spill your heart to. But I really enjoy that when I'm in the presence of an autistic client in my office. Usually they're Microsoft engineers or some kind of software engineer, but not necessarily. I really settle into that connection, the way of connecting. And I think if that could be captured and put in a jar and sold, neurotypicals would like it. They'd want to buy it because it feels better, to me anyway, than the neurotypical expectation of putting on a "how are you, I'm fine" small talk sociability thing
Yeah.
that most autistics just find abhorrent. We don't know how to do it. We don't like it. It's confusing. It raises our anxiety and it burns through our energy.
Yeah. Who invented small talk anyways, right?
Yeah. We tend to be loyal. So that's another advantage that comes with it. We tend to be loyal. Although one of the sad things about being an autistic person is that because we're so reliably misperceived and misunderstood by neurotypicals, we it's common for relationships to end, or you could say fail, and the autistic typically doesn't understand why. And until you understand that it's because you're autistic, you take it personally. Once you understand that it's because of an asynchrony between styles, emotional styles, cognitive styles, social styles, communication styles, thinking styles,
Hmm.
once you get that, then it's no longer a personal matter. It's still, of course, a loss when you lose a friend, but that happens. But loyalty is our inherent nature, many of us. Um,
Yeah. And I want to circle back at that a little bit later, especially when it comes to women with autism, because I think from what I understand, maybe we'll just go into it now, because from what I understand, women with autism, one of the, which is something that really is in the last 3 to 5 years gaining more and more awareness of, because it's a population that often has been underdiagnosed or underseen. And from what I hear is the relationships is one of the biggest ways that women with autism experience a lot of their autism is discord in relationships, like um, difficulties building relationships. Can you talk about that? Maybe with from a standpoint of what you were just sharing about maybe being open and not being received right in that way.
yeah, I'm not sure I'm the world's greatest authority on this topic, but I'll give it a whirl. I was just listening to a YouTuber the other day, a young woman. Of course, they're all young women. I was very late diagnosed, 69 when I got a proper diagnosis.
Yeah.
Gee whiz. So, but I was listening to a young woman talking. She said she believed that autistic women find other women friends and copy them. And I think lots of neurotypical women also do that. From what I can see, they dress the same, they wear the same hairdos, they do everything, they go to the bathroom together, they do all these things together.
Hmm.
And the neurodiverse girl or woman ostensibly tries to fit in that way, but it fails. And I never really did that. I just always knew that I was just a loner and just did my own thing. But what I think happens with me and friends is there's a depth of appreciation, but there's an asynchrony in the communication styles that our way of being and talking is slightly mismatched, and that creates discomfort either for them or for me because somebody's making an accommodation and it feels like a three-legged race with someone with much longer legs or something. It
Hmm.
just doesn't quite fit.
Yeah, that makes a lot of sense. And then can you talk about also masking?
Mhm. Yes, and you mentioned earlier the problem in the field with there being, I don't know if you said terminology. To me, much of the conflict in the field is reducible to conflicts about terminology, what language is permitted and what language is not permitted. And I just read this week that the term camouflage is now preferred to masking, and I'm going, oh,
Oh,
that is constantly a moving target. It just annoys me. And furthermore, it doesn't seem, I mean, why should neurodiverse people be in lockstep? Does that make any sense?
Right.
I want to have my own mind. I want to use whatever words seem to
Yeah.
work for me. And so I use the word masking. So I'll answer your question about masking.
Okay.
But I also understand why the word camouflage might be better. But the idea is, and I don't think I believe this, but the way I've heard it talked about is that women are trained from birth to be more sociable and more attentive to others and to fit into the social group. I'm not so sure that's entirely learned. I think, and I knew Jaak Panksepp, the brilliant affective neuroscientist who invented the field of affective neuroscience, and he would say very plainly that female animals, and he was working mostly with rats, which may not generalize to humans, and he was working with certain other mammals, that the female of the species tends to have a stronger care circuit than the male. And of course, there are exceptions, but we're not supposed to say that. So I'm just not so sure it's entirely learned. But however we got there, females are more likely to be attuned to whether the other one is okay or expecting something. You could get there just through evolution, or you can get there through learning, or you can get there through the interaction of the two, it seems to me logically. Because if you're carrying a baby on your hip and you're a cave woman, you're going to be attuned to the baby, there's the hunter, the warrior, how's he doing? Because your safety is secured by his well-being, and so forth. So it makes sense to me that however we got there, we are more socially concerned. And then the idea is, if you sense or have been told that you don't fit, that you're not comporting yourself with what's expected, you're going to try to pass. And you do that by putting on a mask. I often ask myself, would I have been as successful as I've been in my career? And I have really done very well in my career, international teaching, books, and all that. Couldn't have done better, probably, if I wasn't masking. But the downside of masking is it's exhausting and it burns through what's called one's spoons. Are you familiar with spoon theory?
Yeah, I am. Yeah, that's a very helpful theory. So I don't know if I think it's important for the listeners to hear about it. And I know you reference it in your book, and there are.
So the idea with spoon theory is that you wake up, if you had a good night's sleep, you wake up with plenty of spoons in your drawer. And then something unexpected happens at 10 o'clock, and autistics do not do well with unexpected change. And so that burns through a couple of spoons. And then one was going to do such and so at noon, but something else happened, and the contractor is supposed to come at 2, didn't show up, and then you were supposed to go there. And by 4 o'clock, you're fresh out of spoons, and then you cancel your dinner plans because you need to go regulate your nervous system because there's nothing left to give for whatever was planned for the evening. And I just realized I committed another verbal infraction with my terminology right there. I said autistics tend to do this. That's not preferred language. People on the spectrum is the preferred language.
Okay.
And people who are autistic is preferred language as opposed to autistics, because the term autistics reduces us to as if we're only autism. So,
well, it's interesting. Oh, sorry.
It's a change of subject, so go ahead if you're on track for the same topic.
No, I was just thinking. So related to what you just said, being more than autistic, there's sort of an overlap of conditions that seem to run together and blend together. And for example, anxiety and ADHD and PTSD, and these kind of interface and interweave, and sometimes are often confused with being on the spectrum. Can you talk about a little bit about this thread, the commonality between these conditions?
there's certainly a genetic component to many cases of autism, although there might be other ways to get there. And the same is true for ADHD. And those two, plus OCD, plus certain medical conditions, autoimmune conditions like Sjogren's or certain thyroid conditions, and what's the other one? Ehlers-Danlos syndrome, the hypermobility of joints, tend to be coursing through families. And so that proves to my ear that it's not just a blessing to have autism. So I get annoyed when people say that there's only goodness that comes of autism. I love my autism in many ways, but it's not just easy. It's hard. If you hear snoring, it's not me. It's the dog.
Yeah. I'll throw into that list, and this is being well documented in the research, is mast cell disorders, mast cell activation, which is, a kind of a reactive disorder to chemicals where there's excess histamine and other chemicals that are people who are more like environmentally sensitive seem to be linked in this kind of group of conditions.
Mm-hmm. You mean like people who have to have microdoses or smaller doses of medications than
medications, and they tend to react with more risk of hives and more risk of rashes and more risk of sensitivities to chemicals, smokes.
Right. Yes. So, yeah. And so somebody's going to figure that all out, I'm sure. And in 10 years, it's going to look different than it does now. But the anxiety piece, although OCD is classified as an anxiety disorder, but leaving OCD aside because it seems to be running in that pack with the other things we named, anybody who's in an environment that's overstimulating to their nervous system all the time is going to be anxious and uneasy, because how do you manage yourself? I spent the day in Seattle yesterday instead of on the Rock on Bainbridge Island. And I was in there the whole time going, where are my noise canceling headphones? The traffic noise was murderous. It was so, and I was a wreck by the end of the day. And it's just, I've got a cartoon for this. Self-regulation. Whoops, can you see it? Self-regulation is challenging. He's just walking the tightrope, that thin ledge of managing a sensitive nervous system. And the other cartoon on point that I had all queued up, and of course now it probably fell off, but I'll just use the metaphor if I can't find the drawing, that I see the autistic nervous system. Here it is. It's like a Stradivarius. It's a very precious, sensitive instrument, and you don't bash it around with loud noises, bright lights, heavy chemicals, because why would you do that to a delicate instrument? So the reason I like that metaphor is it accommodates both the brittleness and the gifts, the preciousness of the gifts.
Exactly. So this might be a good time to look at how your work is. What's the aim of your work with autism? What are you trying, or what are you helping with EMDR and other techniques and tools that you're teaching your clients?
I'm doing psychoeducation, both in things like podcasts and workshops with the cartoons and the book, of course, getting the word out there to help people understand better, because it'll go a lot easier for our autistics. But in my office, in my clinical practice, the way that autism is a factor is several-fold. I have an amazing number of people that have never even considered that they might be diagnosed, might be autistic, or they've thought about it but haven't worried enough to pursue it. They're successfully working in their software career or whatever career, and they puzzle over it. And so I can help them walk through, to some degree, that diagnostic process, although it's not a casual thing. A proper diagnosis of autism has to be done carefully.
Yeah.
And I may or may not be doing it. But when we do EMDR with an autistic nervous system, one has to be gentle enough. It goes back to what we were talking about earlier. That when people come into my office who aren't autistic, I don't feather the brakes. I'm surgical. I remind them that the best thing they can do for their symptom reduction is to courageously face whatever is in the basement.
Mm-hmm.
And this time they're not alone, because when they were a little kid and they were neglected or abused, they were alone. They had to keep some terrible secret or just deal with whatever shame or betrayal or disappointment or hurt or wounding they endured. And we repair it. We process to an adaptive resolution with either standard EMDR or repair it in imagination if we're working on attachment repair. When you're working with an autistic nervous system, it has to be done by feathering the brakes a little bit. It has to be more gentle. And the other thing is that autistic nervous systems often have delayed processing. Just as I inoculated you before we started talking about this, I said that sometimes I realize 2 hours later that I actually did know the answer to a question that I thought I knew nothing about. And it takes me a while because of delayed processing, where autistic minds do that. We have so many associations that we can't catch up for hours.
Mm-hmm.
And so I can be sitting here with an autistic individual, and they're often alexithymic, and we really do need to get back and talk about that, but meaning they don't know what they're feeling, and they have trouble identifying emotions or where it is in their body. Well, EMDR depends on the person being able to discern what they're feeling. It's not just a cognitive thing, it's affective and bodily processing. And the person they tend to sound very heady when they're processing because the cognitive domain is where they live, many. And then in the middle of the night, the affective and bodily catches up with them, and they wake up with a nightmare, and then they come in for the second of the 3 days saying they had a rough night, and it was delayed processing. So it's important that the EMDR clinician feather the brakes, or better yet, I get them on low-dose naltrexone. Not that I'm a prescriber, I'm not, but I help them find a prescriber who can assess their appropriateness for low-dose naltrexone. And that's a really interesting thing, and this is going to be over my pay grade, and you're going to be better able to talk about it, I'm sure. But the idea is, if you take a neglected or abused child, let me start with the gazelle out in the African savannah. Let's say you're a gazelle and you've been trying to outpace the lion, and you're losing, and you're about to be had for lunch. In the last moments of your life, you're washed with endogenous opioids that allow you to feel less pain. That is the same mechanism that children, abused or neglected children, employ in order to not feel pain. And so that the abandonment, the betrayal, the violations aren't quite as horrific. They go numb using their bodily endogenous opioids.
Mm-hmm.
And naltrexone is an opioid antagonist. Low-dose naltrexone, and this was a discovery, I think, by Jaak Panksepp. It was certainly an early one, if not the first, to use an opioid antagonist to block that tendency so that people who are alexithymic, and there's 2 ways to get alexithymic that I know of, can begin to discern their own emotions and body sensations, which we have to have for EMDR to be successful, so that we can process through historical trauma to adaptive resolution. The 2 ways to become alexithymic, meaning not having words for emotions, but the term is also used for somebody who can't identify bodily sense of emotions. What was I saying? The two ways to get there are either autism or neglect. When there's a frank abuse, like big T traumas that anybody would say was a trauma, those folks often end up structurally dissociative, as in multiple personality, or as lesser forms, which is what my first book was about, looking through the eyes of trauma and dissociation. But when there's neglect in the first years of life, the child can cut off their emotions and body sensations, and that's the modifications to EMDR that I mentioned that Katie O'Shea developed, and I collaborated with her and wrote this book, When There Are No Words. This one is for therapists, although it's got full of cartoons, so the lay public can also enjoy it. But what I don't know yet is the reason that many autistics, are alexithymic, because their window of tolerance gets overwhelmed from the get-go in life. And therefore, they were relying on endogenous opioids, resulting in somatic dissociation of affect and body sensation. I don't know if it's acquired or if it comes with the autism. It's really going to be interesting to watch somebody figure that out. Uh-oh. There, we got a wobbly connection. Try again.
It's fascinating that in your book, you talk about all the different ways that the nervous system can become overstimulated. And also, you mentioned things like gluten and casein or gluten, dairy. And these are topics that I think go back also to some of the biomedical suggestions for autism. So it was really helpful for me to see some of my world interfacing with your teachings. And I don't know if you want to comment a little bit about that.
Absolutely. If you're already under siege because you're bombarded with lights and sounds and textures and interruptions, we haven't talked about interruptions. Oh my gosh, let's talk about interruptions at least briefly. And then you add foods that attack you from the inside. It's so many people do better without gluten and dairy. And of course, that has to be tested empirically, but a person can do that themselves even, or with guidance. And it makes a lot of difference. So a person can really settle down without being attacked both from the inside and the outside.
Yes. Yeah, I guess how I'd like to wrap up today, because this was really very helpful, and not only just talking about it from academic and clinical perspective, but just the fact that you're living this and the way that you're able to just bring the listeners and all of us into the world. And it's just very unique to have this conversation. So I thank you for being vulnerable enough to share your experiences, and then also just helping us see the picture of how the work that you do could help. I'd like to finish up with maybe your insight or hope for the future for this work and for people who are on the spectrum. And what is your hope for the future, like in where we're headed?
Okay. And I want to just say we bookmarked interruptions, and I'll just refer people to my book. It has cartoons about why and how difficult it is for autistics to be interrupted and make transitions from one state to another state. It's fascinating. It's maybe my favorite part of autism to talk about that challenge, but I'll just.
Well, I don't want to cut you off.
No, I want to read it in the book.
Yes, there you go.
I worked hard on that sucker. I don't know, because it's not realistic to expect neurotypicals to accommodate a small percentage of the population. And yet that's what autistic individuals are calling for. In the activist movement, the bottom-up movement, it's saying, please make room for us. I think at a minimum, it could be that many people would recognize themselves in some of what we've discussed or in the cartoons and realize that there's nothing shameful about asking for the support that one needs and designing one's life to accommodate what one needs to use your gifts to their best advantage. I'm really fortunate. I have a husband who is completely happy to support me. And one of the definitions for what's now called level 1 autism, for another minute, is, it used to be called high functioning autism, but that is one of the impermissible words, even though I was rather fond of it. But he's completely happy to make it possible for me to use my gifts by supporting me in the ways that I need support. So he helps me with all the transition time that I need. God knows he allows me to go on one of my long-winded pontifications. I call them white papers. I write white papers in the air. And God forbid he should try to have a neurotypical discourse where you interrupt and have a free-flowing exchange of information, because then I'd have to start over with my first bullet points, go through the whole thing again, because it's logically built. So he's willing to accommodate all that because he's supporting and sees that as a legitimate way to be and a service for the world. His support of me serves the world because I serve the world. And I don't know what's reasonable to expect the world to do. I know that people aren't getting it yet, not much. So I guess I'll just keep trying to put cartoons out there that telegraph ideas rapidly so that more people can understand. But it's going to take research. It's going to take activism. It's going to take a lot of health providers becoming aware, and that's why I'm really grateful that you're doing this, because I'm sure it gets out there even more. So
Yeah.
that wasn't very visionary, was it?
No, I think it is, because I think what I've seen happen is there was a kind of phase where people on the spectrum were reaching out to their employers and saying, I've got this going on, I need some accommodations. And then what I've seen for the last 3 or 4 years, people being afraid to do that because there could be like a cap on their career, or they get put into a kind of a view. And I think more people are just wanting it to be something that they own themselves and learning how to live with it, and to be able to educate the loved ones and their community and close friends about what they're going through, I think is probably a great step, so that, there's an understanding and a relatability and appreciation and a support. This is, so I guess what you're saying to me falls in line with that, is just awareness, understanding how to support each other.
When I decided to go, I had no intention of going public about my autism until a few months ago, when I realized that I could not publish this book without owning up to the fact that I'm autistic. And I had been afraid that it would hurt my career. But I realized, I'm 71 years old. It's easier for me than somebody who's 30 or 40 may or may not feel like they could afford to come public. But there's really nothing to be ashamed of. It's just a nervous system difference. It's differences. That's that. And so I knew I couldn't. The minute I went public that I was going to publish this book, it wasn't even 5 minutes before somebody demanded to know my lived experience. And so there was really no choice. But I must say, I'm glad that I have, because I'm not pretending.
Yes.
And so it's metabolized what my masking consists of. I might put on a jacket and pearl earrings to comport myself with certain conventions, but
Yeah,
I don't have to pretend I'm not autistic.
exactly. Yeah. I think that's a very great message and a good place for us to wrap up. If there's any kind of closing thoughts about how people can find your work and just anything else you'd like to share, we'd love to hear.
Let's see. All my books are available on Amazon.com. There's 8 of them now, different subjects. Sandra Paulsen is spelled S-E-N. And my website is paulsenpsychology.com. I only work in the 3-day intensive format. Pretty expensive, but it's, if you think how much money you save on the commute you're not doing to and from therapy, weekly therapy sessions, us justifies itself. I think the software engineers do that math. And what else? I guess that's mostly it. Paulsenpsychology.com, Paulsen. And I'll be in, I keep telling myself to retire, but so far I can't because I'm
Yeah.
so happy seeing, not doing miracles, but seeing miracles of healing using EMDR.
Yeah. We really appreciate it. Thank you for being here. This was so wonderful.
My pleasure. Take good care.
Thank you so much for tuning into this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.